So when we're gonna do, if we're gonna do the low back, I'm gonna brace here and put my forearm across the knees, and I'll bend up a little bit. You feel the stretch in there? And then when I wanna do the mid back, I'm gonna switch. I'm gonna move my body down a little bit and rest my forearm across her tibias. And then with my free hand, I'm gonna put it on her sacrum. So I'm gonna lift your body forward and my other hand's gonna go on your sacrum. So you're gonna move your arms out to the side. And so this one allows me to stretch more of the mid back. Notice the dynamic sort of motion. Pretty easy. You guys have probably seen that before. Then hip. We're going to bend one leg. And we're going to bend it up. This leg's going to stay flat. This leg I'm going to bend into her, up to her chest. And I'm going to put both my hands on her knee. And what I'm going to do is press down. You should feel that like your SI joint or your low back somewhere in your hip. Feel that stretch.
It's like a spreading sensation.
Yeah. Then ankle, I'm going to support with one hand at the heel and the other hand we'll put at the pad. You don't have too much stretchiness in your foot. She needs to have this done. So there's stretching at the ankle.
Are you rotating or are you doing just
I'm bending back and forth.
back and forth?
You certainly could do that just as well, but maybe at that point we might call it some other rotating instead of bending, but it's the same idea, not radically different. And then you can do the knee here, where I'm gonna brace her foot. Either I got a little on my shoulder and I got her heel here, and I'm gonna try to keep her knee aligned with my free hand and I push forward. All right, and then if you'll sit, this next one is for the shoulder. This is bending for the shoulder. Some of these, you may not feel like when you practice it, you may not feel too much going on because you guys don't have an injury in that area. So keep that in mind. It doesn't feel like, oh, it's not doing anything. It's not exactly like a stretch, right? It's to kind of treat an injury. If you don't have an injury, maybe it's not clear exactly what it's supposed to feel like. But this is an example of that. I just know from experience if you don't have an injury in your shoulder, because you may not feel very much. So I'm going to stand behind her. I'm going to grab her wrist underneath her armpit, and I'm going to cushion her bicep and tricep with my muscles in my forearm. Relax. Relax more. All right. And I'm going to press at her elbow and squeeze her bicep onto my arm.
Stretch.
Now, if you're not careful, what'll happen here is you'll just hurt her bicep. Like she won't feel anything in her shoulder. So this can take a little bit of maneuvering to get to a position where my radius and ulna are kind of out of the way of her bicep muscle. So if I did it like this, then all that would happen is the soft tissue pressing into my bone. And that's not really exactly what I want. I want it to go up here into the shoulder. I'm also pulling my forearm up a little because I'm trying to get all the pressure of the bend here in the shoulder. Does that make sense? That was a little funky. You'll see when you practice it a little bit that one can be a little funky. The elbow, I'm going to put one thumb on the biceps tendon. Put one thumb on the biceps tendon and support her hand or her elbow with my hand. My other hand, I'm going to grab her wrist, and it's the same thing. Wrist, I'm going to interlock my digits with her digits, and I'm going to bend. I can emphasize the flexion or the extension, or both, however you want to do it, wherever you think is going to be the most benefit and for your buck.